What you should know about hair loss. Alopecia, or hair loss, is a fairly common condition. Although it's more common in older people, anyone can get it, even kids. The American Academy of Dermatology estimates that between 50 and 100 hairs fall out on average per day AAD. In most cases, new hair grows in to replace the lost hair, although this isn't always the case. Hair loss can occur suddenly or gradually over many years. It could be either transient or permanent, depending on the underlying cause. Trying to determine whether you are genuinely losing hair or merely shedding some hair is normal? Not sure when a doctor visit is necessary? 1. Symptoms of hair loss. Although excessive hair loss is the primary sign of alopecia, it might be trickier to spot than you might expect. The symptoms listed below can give some indications. Widening part. If you part your hair, you might start to notice your part getting wider, which can be a sign of thinning hair. Receding hairline. Similarly, if you notice your hairline looking higher than usual, it may be a sign of thinning hair. Loose hair. Check your brush or comb after using it. Is it collecting more hair than usual? If so, this may be a sign of hair loss. Bald patches. These can range in size and can grow over time. Clogged drains. You might find that your sink or shower drains are clogged with hair. Pain or itching. If you have an underlying skin condition causing your hair loss, you might also feel pain or experience itching on your scalp. Why does hair fall happen? There are several basic categories of hair loss, each with a unique set of root reasons. 1. Alopecia androgenica. Hereditary hair loss, such as male pattern baldness or female pattern baldness, is referred to as androgenic alopecia. Up to 50% of people are affected by it, making it the most prevalent cause of hair loss. Androgenic alopecia-related hair loss typically occurs gradually. While some people may start losing their hair at puberty, others may not start noticing signs until they are in their middle years, which is between the ages of 6 and 11. Female pattern baldness frequently causes thinning of the scalp all over. A broadening or thinning surrounding the portion could also be the appearance. Male pattern baldness often causes a M shape to the head due to gradual hair loss above the temples and thinning towards the crown. Due to the autoimmune disease alopecia areata, your immune system attacks your hair follicles, causing little to big bald patches to appear. It might result in total hair loss in some circumstances. Some persons with alopecia areata also have hair loss from their brows, eyelashes, or other body regions in addition to scalp hair loss. 3. Effluvium anagen. In anagen effluvium, hair is lost quickly. Typically, radiation or chemotherapy treatments are to blame for this. Following the end of the treatment, hair normally grows back. 4. Telogen effluvium. A traumatic experience, a prolonged period of high stress, or a catastrophic disease are examples of mental or physical shock that can cause telogen effluvium, a form of sudden hair loss. Hormonal changes, such as those that occur during pregnancy, childbirth, and menopause, may also be to blame. Other possible telogen effluvium causes include starting or discontinuing hormonal birth control, malnutrition, some endocrine diseases. It can also be brought on by a number of drugs, such as anticoagulants, anticonvulsants, oral retinoids, beta blockers, and thyroid treatments. Once the underlying reason is treated, this kind of hair loss often stops on its own. 5. Capitis tinea. Tinea capitis, often known as scalp ringworm, is a fungal infection that can harm the hair shaft and scalp. It results in tiny, scaly, irritating bald spots. These patches' size enlarges over time. Other signs include soreness in the scalp, brittle hair that breaks easily, and scaly patches of skin that appear red or gray. With antifungal medicine, it is curable. 6. Pull-out alopecia. Too much strain and tension on the hair, frequently from wearing it in tight fashions like braids, ponytails, or buns, causes traction alopecia. What are the possibilities for treating hair loss? There are several ways to manage hair loss, but the ideal one for you will depend on the root of the problem. The first line of treatment will probably consist of medications. OTC drugs typically come in the form of topical creams, gels, foams, solutions, or solutions that are applied directly to the scalp. The majority of products have a minoxidil component. In particular for male pattern baldness, prescription drugs like finasteride Propecia may be helpful. Although some people who take finasteride notice fresh hair growth, this medicine is taken daily to reduce hair loss. If hair loss appears to be linked to an autoimmune illness, your doctor may recommend anti-inflammatory drugs such as corticosteroids. Healthcare procedures. Your healthcare provider can suggest one of the following procedures if medicine is ineffective. Surgery to transplant hair. Moving tiny skin plugs with a few hairs, which are used in hair transplant surgery, to bald areas of your head. Given that genetic baldness usually affects the top of the head, this is effective for those who have it. You might require several operations over time if your hair loss is progressive in some cases. Scalp shaving. A scalp reduction involves the removal of a hairless section of your scalp and the replacement of that section with a hairy section. Another choice is a flap, whereby your surgeon covers a bald spot with hair-covered scalp. What can I do to stop hair loss? You can do a few things to reduce hair loss, including: hairstyles should be flowy. Keep your braids, buns, or ponytails loose if you frequently wear your hair in these styles to prevent undue stress on your hair. Do not touch your hair. Try to avoid pulling, twisting, or rubbing your hair as much as you can. Let hair air dry. After bathing, gently pat your hair dry with a towel. Please refrain from stroking or twirling your hair in the towel. Aim for a balanced, nutrient-rich diet,